98.1 FM and AM 1220.
And good afternoon, Santa Clarita. Hey, listen, this is Tom Burton, Director of Operations, Orthopedic Sports Medicine and Spine for the Southern California region, coming to you from Newhall on a special edition ad hoc Providence Holy Cross Health Hour. You know, we find that it's just so important to make sure that our world here within our Santa Clarita Valley community is staying informed, and Holy Cross, as being a very proud provider and grateful provider to the Santa Clarita Valley as well as the North San Fernando Valley, we are here to make sure that you guys know exactly what all is going on. And we take this seriously. We do this proudly. Again, always gracious and thankful to the KHTS family for bringing us in monthly on our usual day, which is the third Wednesday of each and every month. But in unprecedented times, as it is now, it's time to maybe bump up our visits to make sure that everybody stays informed of all that is going on. And you know, it's changing hourly, daily, weekly, of things that to be expected, and how things are going to be moving forward. Again, unprecedented times. We've never really seen this before, and trying to navigate this is going to be new, very interesting, different, and it's really going to make us have to think outside of the box, not only as a medical community, but also just personally speaking. And I'm a resident here, living about 8 minutes from the radio station, and you know, just trying to figure out how to navigate a day when you're used to working in an office, and how to navigate social experiences when you're not actually supposed to be in the presence of other people, maintaining that social distance. You're going to hear that a lot. You're going to hear it so much, you're going to tire from hearing of it, but it's going to be really important to understand. We're talking at least 6 feet away from each other to try to keep that distance, and that might be the distance that it takes for spit to fly out of somebody's mouth and land on something in proximity of the next person. This is the reason why we need to take this extremely seriously. You know, Providence Holy Cross itself, and I'm just going to bring this up, having the lowest mortality rates due to infection in the Southern California Providence St. Joseph's Health hospitals. Our hospital-acquired infections continue to decline. We take infection very, very seriously, and its spread, we try to keep that at a minimum to zero, and we take that very, very seriously, which is probably one of the reasons why we received the America's 50 Best Hospitals Award from Health Grades. An extremely huge honor, which, you know, in talking with our CMO, Dr. Rex Hoffman, the other day in preparation for yesterday's show, Dr. Hoffman, you know, if a person could be beaming over the phone, he was beaming over the phone, just to understand that this is an extremely big deal, and we are proud of that. And, you know, it's really important to know that, and again, I'm going to be working off of a computer as I did yesterday, because, you know, the ability to be able to deliver accurate information is going to be important. I just want to make sure that you're going to be getting that as you join me. So for those of you seeing me on Facebook Live, hello, I don't mean to be ignoring you. And for those of you who are listening on the radio, whether it be on 98.1 FM or AM 1220, or listening to us online at your hometown at hometownstation.com, or actually catching us on the app, which, you know, it comes in crystal clear regardless of where you are in Santa Clarita, in the Valley, in California, or in the world. Make sure that you go ahead and tune in through there, because the signal is crystal clear, and you're going to be able to stay up to date of all that's going to be going on. And between Holy Cross and KHTS, hopefully we'll be able to deliver that up-to-date information to keep you informed as far as what we should be expecting and how we should be doing things in order to keep healthy and survive and navigate through these very, very strange times. It's important to know that you have partnered health, especially during this extremely difficult and unprecedented time. We have been here to support Santa Clarita and the San Fernando Valley, Holy Cross has, since the 60s. And we're also supporting all of our surrounding communities as well. Being a trauma center, we are a place of choice for emergency. And so for years, people were coming in from Antelope Valley, from the San Gabriel Valley, all the way down to Santa Monica. They were bringing patients to us because of the quality care that's available, being a trauma level 2 center. The Santa Clarita itself is actually home to probably a third of our patients, and I would say about a third of our employees all proudly call Santa Clarita their home. And so it's extremely important for us to be able to come out and support our communities as part of being just a deliverer of health care, but also part of our mission within the Providence St. Joseph's Health System. We know that information is truly going to be your best weapon, and this needs to be coming from reliable sources, all right? As we have found that the media has been, very, very on top of all that is going on. I have a sneaky suspicion that, anytime these types of things occur, trying to find the place that's going to give you the accurate information is going to be extremely opportunistic for you guys as listeners, as well as allow you to have the confidence moving forward in decisions that you're going to be making. And at this point now, we want to be able to bring you the most up-to-date information as we can for COVID-19. Now, we do know since yesterday, and according to news reports today, that there are some antiviral medications, and what that means is there are certain viruses that we may come across, maybe like shingles or chickenpox and things like that, where you can actually get a vaccination after you've come down with something or medication that will help your body help fight that virus. Now, I know that the medical communities at large are working tirelessly to make a determination if any of the antiviral medications that are presently on the market are going to be effective in treating COVID-19. And so they are fast-tracking a lot of these medications to determine if any of them may become an appropriate treatment in the battle against COVID-19. So we're very, very thankful that that fast-tracking is being permitted. Something that new just came out, and it was there was some disturbing video that we had the opportunity to see coming in over during the week regarding spring breakers out in the Florida region, is that 40% of the hospitalized cases are people under the age of 54. Now, can't really speak to the why, but we do know that that is an astronomical number, okay? And more now than ever, our population, that group, that under 54 group, needs to recognize and follow the social distancing and the sheltering in if you do not need to be out. As we were coming into the show today, that a great reminder: make sure if you don't have to be out for purposeful travel, purposeful visits to for whatever the reason it might be for you to be outside of your house, you need to stay in, okay? And it's extremely important that we all continue to remember that and continue to practice that. We found that the number one way of treating any disease is prevention. And prevention is probably one of the hardest things to do, but it's one of the most effective things that we can do in the battle of any disease, not just the COVID-19, okay? So just kind of keep that in mind. Now, for those who are most at risk, as you heard with Dr. Wilbur yesterday on our show, we kind of stepped into that, and we realized that it is our elderly, okay? The people who are dealing with respiratory or cardiovascular histories, okay? Anytime when there's that may deem almost like a weak link that specifically with those two populations, the virus seems to have a very, very strong hold with, because it seems to attack the respiratory system. For those who are immune suppressed, okay, and we try to talk about what immune suppressed was. Now, only because we hear this, and let's try to figure out what that means. That means our bodies have an immune system. That immune system allows us to be able to battle disease, to battle infection, allows us to have inflammation, as it is a very important part to our immune system. But there are certain disease processes and certain medications that actually can interrupt that some. So what we see is our patients who have had cancer, okay, or in the process of receiving chemotherapy or radiation, that there is the tendency for our immune systems to become lowered and makes us more prone to getting sick, okay, which means more prone to be able to catch stuff. If you're on certain medications, such as medications for autoimmune disorders, for like lupus or rheumatoid arthritis, people who are on chronic steroids to treat respiratory problems, to treat chronic inflammatory problems, such as rheumatoid arthritis or lupus, those types of medications do have a tendency to depress or weaken your immune system, which makes you more prone to be able to catch things. So for that group, all right, specifically, we really want you to be able to stay inside. Don't come out, okay? Just stay in the comforts of your home in an environment in which your body has acclimated to. Your body is used to being at home. It's used to everything within your home, and you're going to be safer there than anywhere. And this also includes who you invite into your home. I think a lot of the misinformation maybe just because we're at home means that we can just have people over as long as we're sheltering in. And really, I mentioned this yesterday, but remember, everyone who comes into your home, you're inviting everywhere that they've been and all the people who have touched the environment where they were. So you're inviting in an entire community every time you invite somebody into your home. And so you want to make sure that you're taking the necessary precautions. Now, I think Facebook Live was actually going when we were walking in and getting ready for the show today. And you may have noticed I Clorox wiped the area that I'm going to be working in, the mic that we're at, my computer. I actually did use my antibacterial sanitizing gel to make sure my hands were clean. If you happen to be just watching, I did actually have to itch my nose and had to hand sanitize again because it's important. We need to keep our hands away from our face. Now, cases in the LA County are rising, all right? And just keep an eye on that. We do know that they're rising, and part of it is that tests are now becoming available, okay? It doesn't necessarily mean that there are more cases than there were. It now means that we're recognizing that those cases actually exist, okay? Now, one of the issues that we find with this is that anytime you're dealing with this COVID-19, we are finding out that you do not have to be symptomatic to actually be contagious, all right? So, which then takes me back to our group of people who are under the age of 54. Just because you aren't ill and just because you don't feel sick doesn't mean that you aren't carrying and can't transmit this to other people. Those other people could be your colleagues, your friends who you're out partying with, people that you're going to the beach in Miami with. It could also be family that you're going to go visit, including your grandparents, okay? So these are all very, very important that you need to realize and recognize the fact that just because you're not symptomatic doesn't mean that you might not be contagious, okay? So hence the reason why we have these quarantines in place. And you know, thankfully they aren't too stringent. However, depending over the next week or two, we may find that we may have more rules that we're going to have to follow as far as how we quarantine. Now, from Holy Cross, okay, so this is something that we're making available on the Providence website. So if you go to providence.org, here you're going to be able to find out up-to-date information. It'll be a yellow banner right at the top of the web page, my recommendation. Click on it, all right? You're going to find a lot of information there, but a couple of the pieces I'd like to highlight again. On the right, in a blue box that will be following you as you scroll down, is the coronavirus assessment tool. Very, very helpful. Click on it. Go through the questionnaire. See what it says, okay? There's a link to the California Department of Public Health, where you're going to be able to get up-to-date information as that is an agency that is going to be making decisions for us and our health going forward. Also, there's going to be information on prevention and recognition, okay? That's very, very important. Remember, prevention, the number one way of battling most disease, all right? Outside of that is recognition and early recognition, which is going to be extremely helpful. Now, going into prevention, listen, these tips aren't just because of COVID-19, all right? These tips are just general common sense. There's no surprise here, and these are things that we should normally be doing anyways, all right? And that's important to know. It's not just because of COVID-19 that we're doing these, and then once that scare goes away, we can go back to our usual unhealthy ways that we handle ourselves. No, we need to, one, wash your hands frequently, okay? you're talking, and when you wash your hands, and even being in a hospital or visiting at restaurants, you see people go in, use the restroom, they rinse their hands with some water, dry them on their pants, and walk back out. No, that is not washing your hands, all right? You're going to use soap and water, all right? As of right now, I know that there's been some comments on TV and things in the media, including coming from our government, where they're talking about the idea that warmth has an effect on the COVID-19 virus, in essence disabling it. And as of right now, according to what we're able to find out, that presently is not true. Okay, that is not accurate, and we don't have proof that will demonstrate that. So, ideally speaking, soap and water, warm or cold. Warm is obviously more comfortable, but warm. Make sure you're using soap and water, and you're going to wash for 20 seconds. All right. Whistle "Happy Birthday." Whistle "Yankee Doodle." Whistle 20 seconds of a chorus of one of your favorite songs now. Whatever it takes to be able to go ahead and do that. You're going to wash your hands before you eat. Okay. Maybe wash your hands after you eat. If they are obviously dirty, you're going to want to wash your hands after using the restroom. Please, all right, this is, again, common sense. After being in public, so as soon as I'm done with the show here, going to go ahead and wash the hands. After you blow your nose, cough, and or sneeze, because remember, we have to cover our mouths when we do this because spit's flying out, and it's traveling a great distance and moving at a pretty good speed. If you don't have soap and water available, hand sanitizers, but it must be 60% alcohol or more to be effective, okay? Now, hand sanitizer shouldn't take the place of soap and water. Use soap and water when you can. Also know that hand sanitizer after 4 or 5 applications, it is beneficial to go ahead and wash your hands anyways. Make sure you cover your mouth and nose when you sneeze, cough, using a tissue or into your elbow, okay? And again, wash your hands afterwards. Again, anything that comes flying out of your mouth or nose can be transferred to something else. And a lot of viruses, not just COVID-19, but a lot of things are actually droplets. So you can actually put it onto a table and another person come up, touch the table, and transfer it to themselves. And that's how these things occur. All right, and the COVID-19, for certain services, it can last for hours to days. And so we need to be very diligent in keeping everything clean. And part of that is by making sure that nothing hits surfaces in the first place. Avoid touching your face. As you notice, I actually scratched my mustache before I actually do anything else. I'll probably use a hand sanitizer at our break coming up in about a minute. And if you don't feel well, just stay home, all right? Most important, all right? We understand the importance of being able to get out of the house and that you're bored, but if you're not feeling well or to be able to get to work because you need to be able to have the pay, if you leave your house and you don't feel well, you're potentially putting everybody else at risk. And this is the idea of the quarantine. We want to decrease the spread of this. And you've heard about flattening the curve. That curve becomes steep when we have a lot of cases. The lesser the cases, the flatter the curve, and it's all on us at this point to make sure that doesn't happen. So I know we're going to be going to break right now. You're joining us on the special edition of Providence Holy Cross Health Hour, 98.1 FM, AM 1220, KHTS, and we'll be right back.
I'm Dr. Travis Stork, host of The Doctors, here to talk to you about the coronavirus COVID-19. There's currently no vaccine to prevent coronavirus. The best way to prevent illness is to avoid being exposed to this virus. The CDC recommends the following everyday preventive actions to help prevent the spread of respiratory diseases. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with a tissue. Clean and disinfect frequently touched objects and surfaces using a cleaning spray or wipe. And if you think you may have been exposed to COVID-19, please contact your healthcare provider immediately. For more information about the coronavirus, log on to cdc.gov.
Lots of people can build websites, but there's one Santa Clarita company that specializes in designing websites for your business, Small Dog Creative. The Small Dog Creative team is made up of local designers who are hands-on. Their talented team of experts build premium websites and redefine branding. Small Dog Creative doesn't just build websites. They'll upgrade your business's online presence and turn your business into a powerful online brand. Small Dog Creative. Santa Clarita's most innovative web and design company. SmallDogCreative.com.
The Art Gallery of Santa Clarita Artists Association, located in downtown Newhall on 6th Street between Railroad and Main, features local members' original artwork with changing exhibits every 2 months. Purchase affordable art for your home or as gifts. Open Friday through Sunday or by appointment. Artists wishing to join the SCAA can visit santaclaritaartist.org, come to our free monthly meetings at Barnes & Noble, or stop by the gallery. For upcoming shows, check us out at santaclaritaartist.org. We make visual art visible.
Dreaming of becoming the next Steph Curry or Klay Thompson, or maybe just you want your kid to look good and have fun on the court? Introducing the Shotmaster. The Shotmaster is a revolutionary basketball training aid that isolates the shooting pocket, allows you to develop that consistent shot. Shotmaster will improve your shooting efficiency, accuracy, and shooting percentages dramatically. It's the ultimate training device. There's nothing like it. Visit shotmaster.net and discover for yourself how Shotmaster will become your game changer. Shotmaster.net.
Your hometown station, KHTS.
And welcome back, Santa Clarita. Joining us here on this special edition Providence Holy Cross Health Hour, coming to you live from the Newhall station where, you know, it's beginning to rain. It's, I guess, if you have to shelter in, this is the type of weather that you're going to be able to do it with. And thankfully, we have 9 million shows. So part of what we need to be doing as we're sheltering in and creating social distance, we might be able to enjoy each other's company virtually. Make sure that you make your recommendations for all those special shows that you've enjoyed. Pass those on. There is countless years worth of movies and shows that are going to be available that we all can take part of that normally our day wouldn't allow for. Now, we were just talking about some of the different things that we are able to that we need to be able to do to help prevent. And we left off at if you don't feel well, stay home. Now, face masks. If you are sick and going out, wear a face mask. Prevent what's coming out of your mouth and nose from getting on objects and surfaces that others may touch. You as a healthy individual, however, and if you have not been exposed to COVID-19 and are otherwise asymptomatic, utilizing a face mask at this time isn't going to be helpful. In fact, they've actually been able to demonstrate that you end up touching that face mask and adjusting that face mask so often that you're going to contaminate yourself anyways. So it is actually better to not wear that. Now, also most important is to realize there is a shortage, all right? The N95 masks and as well as the surgical masks that people are using, everybody has been buying them. They're actually not becoming available to our hospitals and to our clinics. And this is extremely important to understand that our medical teams, in order to be able to continue to bring the medical services to the communities, to ensure not only people are being healthy during the COVID-19, but with any medical problems that they're dealing with, we need to ensure that they have the necessary protective equipment, not only to protect themselves so they can continue being the heroes that they are, coming in every day. While we're sheltering in, they're turning around and actually walking into the mix. Okay, so they need to be as best prepared and best equipped, and they're having troubles keeping that in stock, so that way they can do a fantastic job. If perchance in your work commercially and what you do, if you have a stockpile of N95 masks or surgical masks, we see this with carpenters, with painters, with people who do demolition and things like that. If you have unused, still sealed masks, and you're in a place where you can donate those, please donate them to either Holy Cross, your nearby hospital, your urgent cares, to make sure that they have the necessary equipment in order to be able to protect themselves, so that way they can continue to deliver care to those who need it. Okay, so be careful with that. Stay at home. If you have a history of respiratory issues, cardiovascular issues, if you're immune suppressed, remember that's if you've had cancers, if you've had surgery, if you're on medications that can commonly depress your immune system. Keep social distancing. Keep at least 6 feet. If you have to be out in the public, avoid gatherings and avoid the gatherings. Recommendations is anything more than 10 people. But you know what? If you don't need to be out, don't be out. Stay inside the house. And if you have to go out, make sure it's for purposeful reasons, okay? Extremely important. Now, I know here at the station there was a question of whether or not people can go out and walk. And the answer to that is yes, okay? Out in open spaces, maintaining social distancing, it is okay, according to the County of LA, to go out and walk around, okay? And let me tell you, part of prevention is staying healthy. Get a great night's sleep. Eat a well-balanced diet, okay? Stay nutritionally fit. Stay hydrated. And make sure that you keep up with your exercises, whether you do it inside the house or if you actually have to go out, and even just going out for a walk, okay? All of that is going to be extremely helpful as far as being able to stay healthy and really kind of ramp up your immune system. The healthier you are, the more likely you're going to be able to fight things if you become exposed to them. Now, if you start to feel sick or believe you've been exposed to someone who might be sick, including those who have been sick with COVID-19. So remember, this is just in general. Make sure you stay at home, okay? Avoid public transportation. Call your health provider or schedule a virtual visit. Don't just go into the urgent cares. Do not just go to the emergency room unless if you have to get to the emergency room, it needs to be for an emergency. Or if your healthcare provider has directed you to do so, usually because you're going to be admitted. Just don't show up. The emergency rooms are full, all right, with normal emergency type patients, heart troubles and traumas and things like that they need to keep those beds available. So if you can, do a virtual visit, okay? If you don't know a virtual visit, call your insurance. Ask them if they have virtual health available to you, okay? Express Care Virtual is something that's available where you can actually call in and for a small co-payment or maybe no co-payment if they take your insurance, you can actually talk with a healthcare provider and go through their assessment, okay? So just know that those types of things are absolutely available. You're going to want to stay away from people if you're sick, okay? So shelter in. When that says shelter in, maybe not having the whole run of the house if there's other people in the house. You may need to stay in one specific room, okay? Don't share towels. Don't share toothbrushes. Don't share hairbrushes. Try to use things that may be more disposable or can be easily washed. You want to monitor for fever, cough, and shortness of breath, and make sure that you wash your hands. All right, and I can't say this enough. Washing your hands is probably the easiest thing besides prevention, including prevention that you can do to be able to keep from getting sick. Now, for self-monitoring, all right, this is going to be important to know. What we're looking for, as we talk about COVID-19 specifically, we're looking for fever of 100.4, 100.4, not 104, 100.4 degrees or greater, a sore throat, if you have a cough, okay, if you don't feel well, experiencing shortness of breath, difficulty breathing is what that means, and just know, have you been in contact with someone who potentially or knowingly has contracted the COVID-19 virus? All right. Have you done any traveling abroad to countries that have had issues? Okay. And those countries can be found on the CDC guidelines. So make sure that you keep informed. CDC is a great place for your information. Okay. Providence Health System, Providence St. Joseph's Health System is a great place to get up-to-date, accurate information. Okay. We're following the CDC guidelines as well. Now, Holy Cross itself is working diligently to ensure the ongoing health not only of its patients and its community, but also of its staff. And because of this, our employees, before they even start their shifts, they're taking their temperatures before their shift, and they're attesting that they feel well and that their health that they are in good health prior to starting their shift and becoming involved and in contact with other patients. Now, if they have symptoms, they're going to be asked to go home, okay? Which basically is going to be running a fever if they're not feeling well. Employees who are involved with direct patient care are being asked, are not involved with direct patient care, they're being asked to work from home. I am not in direct patient care. I am working from home. And so to try to lessen the number of people coming in from the community into the hospital to decrease the amount of exposure. Holy Cross employees are following standard and transmission-based policies and procedures to keep themselves, their patients, and any visitors at the hospital safe. And Holy Cross follows a very specific exposure protocol. Just in case there is an exposure to an employee, they have a specific protocol in place on how they're going to be able to take care of that employee. All right. All of our meetings are now virtual. All right. Everything's being done by the phone or online. And that education activities that we've been actually providing for our patients, including, if you've heard me for enough times on this show, we talk about our preoperative total joint replacement class. All of that is now being offered online. And you can talk with our patient engagement center at 188-HEALTH. And we can actually try to see if we can't get you involved in an education that can be done online. We're also doing one-on-one phone calls where necessary for patients who will still be coming in for surgery, even though know that Holy Cross is canceling a number of their elective procedures. Again, we need to make sure that we're keeping our hospital open to ensure that we're going to be able to give and deliver the best care and appropriate care and timely care to anyone who comes through. Okay, we are as of earlier this week, we are following a very strict visitor guideline, and in essence, it's this: you're going to be allowed one designated visitor to accompany a patient if they're going to one of our outpatient clinics, whether it be a medical office building, a diagnostic center, or an infusion center. If you're in the hospital itself, we're allowing one designated visitor if that patient is in labor and delivery or postpartum. In the neonatal ICU, if the patient is a minor, we need to keep a visitor to accompany the minor. However, in short stay, we are only doing drop-offs and pickups only, and no visitors. For our emergency department, no visitors unless the emergency department deems it necessary to have somebody there, and they will make that decision. We also need to make sure that patients receiving end-of-life or palliative care, those cases will of course be reviewed on a case-per-case basis, and our house supervisor will determine the permitted visitors. Okay, so those type of special circumstances, that will be left to the house supervisor going forward. One of the things we're trying to do is trying not to clog that emergency room entrance, okay? Because when you come to Holy Cross now, and in a lot of cases at other clinics, there will be one entrance now, not multiple entrances. And at Holy Cross, you're going to be asked to enter through the emergency room, where we have a screening area. They're going to be screening for cough, fever of greater than 100.4, any shortness of breath or difficulty breathing, and any exposures to a person diagnosed with COVID-19 or travel outside of the country. Okay, so from areas where we know that there's a large number of people with COVID-19. So if any of those are positive, now this is important, you might be tested depending on how that screening and secondary screening goes, all right? You may be asked to leave and quarantine yourself at your home. Now, and then follow up with a virtual medical visit or follow up with your normal health care provider for next steps, okay? Please, please, please do all of these check-ins with your health care provider or urgent cares before you go. You need to call ahead. They may tell you you need to shelter in and follow up with your health care provider if it's not something of urgent or emergent basis, okay? And the reason for this is we're trying to minimize exposure. Now, realize that even if you have a test done, as we heard from Dr. Wilbur, it could be a week to a number of weeks before we get that result back, whether you're positive or negative. So it is the safest assumption just to assume that it's positive, and you're going to shelter in and you're going to quarantine for at least 14 days. And why is that? Because as of right now, we're being told that that virus, if it's going to start to show symptoms, from exposure to symptoms, can be upwards to 14 days, which means, remember, and this is the problem we're running into with that group or that population of the under 54 who believe that they are healthy because they feel great. 40% of them are making up our hospital admissions because they are carrying and they are getting sick. So we need to make sure you quarantine for those 14 days and only come to the emergency room if it is emergent, if you're having issues with that, and also if you're directed by your healthcare provider. You do have options. Call your healthcare provider. Check in with virtual health. Check your insurance and see if that's available. Make sure that you call an urgent care ahead of time, the one that's associated with your insurance. Realize that Providence does have urgent cares between FACI as well as EXER, but understand that with these urgent cares, the preference is please call before you come, all right? We need to make sure that it seems to be an appropriate visit going to the urgent care prior to exposing those in the waiting room and exposing the medical staff if it's unnecessary, okay? The ability to support our communities, and that, this is pretty darned important here. Our ability to continue to support our communities really is a mission of ours, and we will continue to do that, and we proudly do that and graciously do that. However, we do need our community's help. One, shelter in, all right? Please make the correct decision to stay in your house if you do not need to be out. Again, if it's purposeful, then go out and take care of what you need to take care of and come back. But you know what? While you're out and about, make sure that you sanitize. And let me throw a quick thanks out to our grocery industry. One, I know people are upset because they can't find things, all right? And that's not the groceries industry's fault. They're supplying as much as they can. And but you know what? They're coming in and tirelessly trying to make sure things are stocked as they can. Everyone that I've encountered have been extremely pleasant in the amount of stress that they've been going under. And I'll tell you what, every time I've walked to a grocery store, there have been hand sanitizers and cloth wipes at every entrance to ensure that we can clean our baskets and make sure that our hands are clean as we're going through. Make sure also, hey, just note, if you're wearing gloves while you're at the grocery store, the only person that you're protecting is yourself, because everything you touch, you're spreading to everything else, okay? So gloves, wearing them out in the public isn't necessarily going to decrease the transmission of the virus. It may be creating a level of maybe a feeling of self-security, but you may be actually making things worse, okay? So just kind of keep that in mind. So make sure that you sanitize your baskets before and after. Make sure that you practice good hand washing skills and the such. All right, so we need to make sure that our communities are making the right decisions, and that includes who comes to our medical facilities for care. Make sure that you follow up first by phone. Only come to the emergency room if it's emergent. Go to the urgent care only if you are guided to go to the urgent care. Don't just show up. They are very low in supplies, as are hospitals. And so we need to make sure that we are protecting our staff as well as protecting our guests, visitors, and families, and our patients as well. So we need to make sure that is all going well. Any donations that you can make for those who are who carry a par level of N95 masks or surgical masks because of the work that they do in a sealed, closed and sealed, and they're new boxes and the such, it would be greatly appreciated by our medical communities that if you could donate some of your stock to the hospitals and to the urgent cares and to the medical facilities, so that we can ensure that not only are we protecting our staff members, but also protecting those who are coming into those clinics. Very, very, very important. As we learn more, we're starting to gain a better understanding of the personality, the profile of what this COVID-19 virus is like. And as we gain more information and glean more information, we're going to be able to better understand exactly how we can move forward, how we can prevent, how we can protect, how we can treat. And later on, as we find maybe in the next year or so, maybe how can we inoculate? How do we give an injection so that, similar to like your flu shots that you get during the fall, in order to help stave off catching the flu or the symptoms that can occur with the flu going forward during the flu season. So hopefully we'll be able to have that as time goes on. There are no vaccinations as of yet, all right? A lot of scam out there. You have to be very, very careful. If it's not coming from your physician's office, then chances are it's probably not appropriate. And people are out there trying to take advantage of a situation. We need to make sure that that you are putting yourself into a position that's going to allow you to be safe. Okay, so that's going to be extremely important as well. So just remember, stick with KHTS, stick with Providence Holy Cross or Providence Providence St. Joseph's Health System. Keep an eye on the reputable sites for all of the up-and-coming information, the CDC, the LA County Department of Health. All of these are going to be fantastic outlets to be able to gain more information going forward. So that way we're going to be able to keep ourselves healthier and allow ourselves to decrease the transmission of this disease and move back into a level of normalcy within our lives. You're joining us here, this special edition of the Providence Holy Cross Health Hour. I'm Tom Burton. You're joining us here on 98.1 FM, AM 1220 KHTS, and we'll be right back.
I'm Dr. Travis Stork, host of The Doctors, here to talk to you about the coronavirus COVID-19. There's currently no vaccine to prevent coronavirus. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. And if you think you may have been exposed to COVID-19, please contact your healthcare provider immediately. For more information about the coronavirus, log on to cdc.gov.
At iLead Agua Dulce, we believe the most important thing a child can learn in school is who they are. Life's real tests are never standardized, which is why we've developed an individual-based curriculum that values exploration, cooperation, and creativity. As our learners grow, so do we. Our tuition-free charter school is currently enrolling grades TK through 7th and adding 8th grade in 2020. Your young learner will be immersed in a unique environment where possibility and self-discovery are at the core of every experience. The Agua Dulce campus features beautiful indoor and outdoor spaces for hands-on inspiration, including a robotics lab, a garden bed, a greenhouse, and a technology-based exploratorium. iLead Agua Dulce is conveniently located on the east side of the Santa Clarita Valley, just off the 14 freeway. Check out our homeschool options too. To schedule a campus tour or learn more about our programs, visit ileadaguadulce.org. We're enrolling now. iLead Schools. Free to think, inspired to lead.
The best live theater can be found right here in the Santa Clarita Valley. The Canyon Theater Guild has been entertaining audiences for decades with top quality musicals and plays. Located on Main Street in Old Town Newhall, CTG also offers workshops for the young actor in your family. For more information, call the box office at 799-2702 or go online to canyontheater.org.
The Santa Clarita Valley Tigers are your hometown football team. We are more than football, we are community. We play football to raise awareness and funds for various charities within our community. We've contributed to Family Promise, breast cancer awareness, and we were there when Saugus needed us. To find out how you can help, check out our website at goscvtigers.com. That's goscvtigers.com. Santa Clarita Valley Tigers football. We're more than football, we're community.
Hometown.
They're amazing, and every single one of their songs is amazing, except for like one.
Your hometown station.
Yeah, welcome back, Santa Clarita. As we were just finishing up with our break for watching on Facebook Live, glad that you had the time to be able to check in, and hopefully you'll be able to deliver some great up-to-date information. You're also catching us on 98.1 FM, AM 1220. We're also on the app. Make sure you pick up the KHTS app so you can hear us anywhere, especially to get that up-to-date information. And now more than ever, it's going to be extremely important because things are changing, all right? From yesterday's show to today, we've gotten more information, including now that the fast-tracking of antiviral medications to make a determination of what may effectively help treat COVID-19, or at least decrease the amount of issues that occur with COVID-19, which is wonderful news. We're also finding out that the number of cases are now starting to show to be more of those age 54 or under. though our elderly are in the most danger because of respiratory problems, because the mortality rate is higher, this group, 54 and under, are making up about 40% of all admissions into the hospitals. And, the hard part, again, is you do not have to be symptomatic to be transmitting this disease. And that's important to know, that the only way you're going to be transmitting the disease is if you're coming in contact with the disease. And the only way you're going to come in contact with the disease is if you're out and about in the public and commiserating with other people who may have come in contact. Okay, so the request by the federal government, by our local governments, by our medical facilities is stay at home. If you do not need to be out, do not be out. If you have to be out, you need to be smart about it, okay? And the idea of prevention, again, is one of the best things that we can do to help avoid any contraction of any disease. So let's talk about prevention one more time before we wrap up the show today. 1, wash your hands frequently for 20 seconds, all right, with soap and water. Soap helps actually take the virus off of the skin. It surrounds it and allows it to be rinsed off. Make sure that you wash your hands before you eat, and because your hands are at your mouth, after you eat. If they are obviously dirty, wash them. And again, remember, these are all common sense. This isn't anything just because of COVID-19. These are things we should be doing and should have been doing all along. After you use the restroom, after being in public, all right? After you blow your nose, cough, and or sneeze, all right? Because the stuff coming out of your nose and mouth are the droplets that are being transmitted to other persons. You need to wash that off and get it off of your hands before you touch stuff. Use hand sanitizer. We have some here. I've been using it in and out of the breaks and such like that because when they tell you you're not supposed to touch your face, that's when your nose starts to itch. And so hand sanitizer is going to be extremely important. Not any hand sanitizer. And you know what? Don't make your own concoction, all right? We are being requested. We've been told hand sanitizers are most effective if they're at least 60% alcohol, okay? And only use it when soap and water is not available, all right? And if you use hand sanitizer a lot, you still need to wash your hands because the chemicals can build up. Cover your mouth and nose when you sneeze or cough with a tissue. You can use your elbow. You can use your arm. I actually coughed a little bit as well. Make sure that you cover yourself so that way you aren't transmitting that spit that comes out of your mouth or comes out of your nose to land on different surfaces because other people are going to touch those surfaces after you leave it, all right? And this is a way we can keep from transmitting disease. Make sure that you wash your hands after you cough and sneeze or blow your nose. Avoid touching your face. This is a big one. You know, it's funny, they said people touch their face anywhere from 60 to 300 times a day, all right? And it may even actually be more. And anytime our hands touch a surface, anything on that surface we bring to our face is how we're going to transmit and possibly communicate that, pick up this disease. So keep your hands away from your face. And believe me, if you do not feel well, stay at home. If you do not feel well, stay at home. Don't go running off to the urgent care. Don't run off to the emergency room unless it's a medical emergency. If you don't feel well, stay at home and call your provider. Talk with a virtual health person. Go to the Providence.org website and take the COVID-19 assessment, use the COVID-19 assessment tool to see what next steps should be. If you're going to wear people who are wearing face masks really should be the people who are sick or the people who are immune depressed, not everybody. Remember, there is a shortage of these and our medical community, the people who are going to be required to take care of our sick and elderly and people who are having issues, they need to stay healthy as well. Stay at home if you have a history of respiratory illness or respiratory issues, cardiovascular issues. If you're immune suppressed or under treatment with medications that can cause immune suppression. Respiratory issues, I'm just going to comment on this really quick. People with chronic bronchitis, people who have asthma, people who have COPD, people with emphysema, people who commonly have gotten pneumonia, people who've had lung cancer, people who have had other issues, people who smoke, people who vape. All of these types of things cause different irritations, which makes your lungs more exposed to the damage that can occur with this virus specifically because it attacks the respiratory system. Keep your social distancing at 6 feet if you're going to be out and about, all right? Walking in open places like parks and things is okay. However, going off and just into gatherings is not a great idea. You need to stay at home otherwise. Avoid gatherings. Our recommendations right now is anything with 10 people or more. However, we say stay at home. Do it virtually, all right? There's a variety of different ways. You can FaceTime. One of Dr. Wilbur yesterday said his wife actually had a happy hour virtually with her girlfriends over the phone, which is a great idea. Enjoy a glass of wine with your friends while you have the chance to be able to socialize, even if it isn't in person. And only go out of the house if it's for purposeful reasons. Otherwise, make sure. Self-monitoring, here's what you're looking for. We've got about a minute left. Fever of 100.4 degrees or greater. If you have a sore throat, if you have a cough, okay, if you experience any shortness of breath, difficulty breathing, if you are finding that you've been in contact with someone with COVID-19 or in an area where there's COVID-19, you need illness, you need to make sure that you shelter in. Quarantines are for 14 days. And remember, please do not clog our ERs or clog the urgent cares. Call before you decide to go. And remember, quarantines are for 14 days. Hey, listen, we're wrapping up now. I am certain we'll be back within the next few days with more information as that information becomes available. Keep an ear and eye on KHTS online as well as the radio or the app. You're joining us here on this special edition of the Providence Holy Cross Health Hour on 98.1 FM, AM 1220, KHTS. Please stay healthy.